Hello everyone. Today we discuss about assignment on school health nursing. Subject community health nursing. First, the introduction of the school health. The school health is an important branch of community health. School health services developed during the past 70 years from the narrow concept of medical examination. Presently, school health services is an economical and powerful mean of improving the community health, comprehensive care of health and well-being of children during their school life. The school health services were taken after the Phone Committee Board Committee report in 1946 that school health services are non-exempted and where they existed they were in an underdeveloped state. In 1951, WHO Expert Committee on School Health Services suggested guideline principle on planning, health promotion, health appraisal, and health restoration of school health services. In 1953, the Secondary Education Committee emphasized the need for medical examination of pupils and school health feeding program. For the secondary definition of the school health services, school health are comprehensive services to provide promotive health prevention of disease opportunity for the full mental, physical, psychological development. Importance of school health services. School involve a large number of the group of children between 5 to 14 year of age. This period of 5 to 14 year is a period of growth and development. Rapid physical, mental, emotional changes occur. It provides opportunity for the nurse to supervise and provide guidance whenever they require. Children are more susceptible to nutrition problem, communicable disease. School health provider an opportunity to identify such disease at early stage. This school population is in very rich, so it easy to implement and assess health problem among them. School is the best place to provide health education and modeling attitude and practice of children. Aims of school health services to promote growth development of school children through health supervision, health care, and national program to prevent and control communicable disease. Provision of health environment, awakening health conscious in children. Objective of school health services: early diagnose, treatment, and follow up the defect. Prevention of disease, promotion of physician health. School health services. Periodic medical examination of children. School Health Committee in 1961 recommended medical examination of child at time of admission every 4 years after the admission history. Physical examination of child. Parent to be informed of medical record to draw their attention to matter of health of the child. The school teacher should be trained to find out people who are deviating from the normal health and refer them to the doctor. It is responsibility of primary health center to carry out school health services in rural area. They are responsible for follow up of such children who are suffering from systematic disease, skin infection, and pediculosis. Medical examination of the school personnel. Medical examination of school personnel should be as they from part of the environment to which child is exposed. School infrastructure. School building and environment also play an important role in school health. School health building should be away from main traffic road with facility of playground. Window size should be 25% of floor area. Per capita space should be 10 square feet per student. There are where the student is studying should have 5% of daylight factor. Special clinic should be conducted exclusively for the school children. The primary health center in the rural area and one in the selected school are dispensary for the group of about 500 children in the urban area. Special clinic should be provided for the exclusive use of school children for the examination and treatment of ear, nose, eye problem. Fifth point is immunization. The children of school should be immunized if they not already immunized against tuberculosis, tetanus, typhoid, diphtheria, cough. A well-planned immunization program should be planned immunity against the common communicable disease. Nutritional. The diet of the school child Importance and physical health depend upon the diet intake of child. Same extent which in term help in maintaining mental health studies have indicated the prevalence of nutrition disorder among school children. The nutrition deficiency disorder are related to the protein, vitamin C, thiamine, and iron and sodium. First is midday meal program in nutrition program. 1961 school committee recommended that school children should take at least one nourishing meal. One who can afford can bring their meal from home can have the meal during lunchtime. Applied nutrition program. The applied nutrition was implemented with the assistance from the UNICEF. Provide assistance in form of providing implemented seed. 7. Physical education. Facility of the physical training, games, social service, reservation should be in the school. Physical training is a part of medical exercise for the minor physical goal deficit. First aid emergency care, all the teachers should be receive adequate training during the teacher training program. So in service a training program for the first aid emergency care for preparing them for deal injured children. School health committee of government of India recommended the school health committee of the village level, district level, national mental health. The school teacher can help the children developing mature, responsible as well as adjusted adult. The school routine should be planned at the should be enough relaxation between the period of the work and effort should be made to relieve the sodium of the classroom, the burden or the stress. So study can lead to mental illness. So me of a mental health problem such malgested and drug addiction. Health education is the most important element of the school health program. The goal of the health education, the personal hygiene, environment hygiene, school health record. The cumulative record for each school child should be maintained. The record should have personal identity of child as name of the child, date of birth, parent name and address. It should include the past history and the finding of the medical examination. Tax services provided from the time to the time during the school role of school teacher. The school teacher should provide midday meals, supervise midday meal program or brought the by student. They should supervise the teacher himself. Should be adopted the role model behavior by adopting health lifestyle. Responsible to the community health nursing, school health services planning implementation. Before the planning of the school health services, community health nurse should collect the information about the school administration, number of student and teacher, available sources, school environment, facility of the environment, secondary coordination. Community health nurse plays to the role of coordination in the school health service. So she has to take up the responsibility of coordination between the doctor and teacher, parents, training and guidance. She plays an important role in the training of the teacher about daily checkup, maintaining health record, active participation, conducting health checkup, children. Providing treatment according to the standing order, provide follow-up services, conducting and directing the immunization program, maintaining school health record, principle of school health services. It should be based on the need of the school. It should be planned in the coordination with the school and health personal commit. It should be part of the community health services. Emphasis on learning through active participation. Be on continuous program. Emphasis should be on preventive and promotive health. At last, the bibliography. A text of book Community Health Nursing by the Neelam Kumari PV 9. Page number 281 to 290. Internet source India Beaks slideshare.com google.com. How this you can make assignment on school health services, a role of nurse. Like the video, comment the video, share this information to your friend and subscribe my channel for more informative video. Thank you.